Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 014. A 45-year-old man developed constricting retrosternal pain that occurs during walks at the distance of 200 meters. Objectively, heart rate is 80 per minute. BP is 160/90ths of a millimeter Hg during cardiopulmonary exercise. Test at 50 W. There is a depression of ST segment by 3 mm below the isoline in V3-V4. What is the provisional diagnosis? A. Alcoholic myocardiodystrophy. B. Exertional angina pectoris, functional class E. C. Somatoform autonomic dysfunction, hypertension type. D. Exertional angina pectoris, functional class E. E. Exertional angina pectoris, functional class IV. Saint depression occurs when the J point, the point where the QRS complex joins the Saint segment, is displaced below baseline. Not all Saint depression represents myocardial ischemia or an emergent condition. In unstable coronary artery disease, street depression indicates a poor prognosis. Conditions associated with Saint depression: hypokalemia, myocardial ischemia, cardiac ischemia. Medications such as digitalis. Myocardial ischemia occurs when blood flow to your heart is reduced, preventing the heart muscle from receiving enough oxygen, usually due to a partial or complete blockage of the coronary arteries of the heart. Angina pectoris is characterized by chest pain or discomfort due to coronary heart disease, that occurs when the heart muscle doesn't get as much blood as it needs, due to myocardial ischemia. Angina pectoris classification. Class I. Angina, only during strenuous or prolonged physical activity. Class E. Slight limitation with angina, only during vigorous physical activity. Class E. Moderate limitation with angina, in everyday living activities. Class IV. Severe limitation. With or without angina, inability to perform any activity at rest. The answer is B. Exertional angina pectoris, functional class E.